Good evening. I will be discussing how nurses can improve screening for child violence in a pediatric inpatient setting for patients over the age of 5. So, to briefly explain that clinical question, I'm actually going to go a little bit into some background on child abuse and reporting of child abuse. So, according to the CDC, or Center of Disease Control, at least 1 in 7 children have experienced child abuse or neglect in the last year. That was from 2000 data compiled from 2022. There's 4 different types of abuse that are within this category of child abuse or neglect: physical abuse, sexual abuse, emotional abuse, and neglect. So for the scope of this question, we'll be looking at physical abuse, which I am going to briefly describe. It is defined as intentional use of force that results in physical injury. And it differs from emotional abuse, because emotional abuse harms the child's self-worth or their emotional well-being. And I won't dive into sexual abuse or neglect. Those are deep topics that would take a lot, that are outside of the scope of this paper, but are also very troubling things that occur. So, unfortunately, for child abuse and neglect, one partial reason for why there's such a high experience of abuse is lack of reporting. And underreporting when there are signs of abuse. And so there are many mandated reporters. I won't go through the entire list, but nurses fall within the realm of a mandated reporter. And what this entails is, if, according to the IHU Health Riley Emergency report, and DCF, which lays out who mandatory reporters are in the state of Wisconsin. It includes school teachers, law enforcement, and first responders, as well as most medical workers. And any perceived threat of abuse warrants report. And so they list signs, which can include guarding, where the child is not wanting to show a certain area of their body, bruising, scratches, belt marks. Oftentimes they're hidden. They may be under clothing. It could even be behavior where the child does not want to show a certain part of their body. They don't want to lift their shirt to show it, or they feel ashamed or scared. Unfortunately, mandated reporters, they're supposed to report, but the tracking of reporting is, there needs to be further implementation for reporting, and it's kind of at the belief of the mandated reporter. So my clinical question is, how can we improve reporting of abuse? And I will tackle this by looking at improving how we screen. And so I'll briefly describe the intervention strategy that I would like to implement, and then I'll explain a little bit of evidence that I have for supporting this, and then I'll continue to work through the remaining sections. But the implementation that I would like to add into that I am suggesting would be a screening tool performed during all assessments of children that will flag further questioning for signs of abuse, and will prompt the nurse to go deeper into a further evaluation. So this was implemented in a in an emergency department in at IU Health Riley Emergency Department. They implemented a screening tool for that was used both by social workers and by nurses. And the tool was originally the tool was only used by social workers. And during the change of this emergency department, there were 2 initial questions that would flag further questioning from a social worker. So it kind of did 2 purposes. It screened all children, not just children that showed signs of abuse, but every child. One of the questions was there any signs of physical abuse, which could include bruising, scratching, and there's the ability to write further into it. And then one of the other questions is, were the guardians not present, or were they like overbearing? So both of those may show signs that there could be abuse. It also could not be, but it flagged the social worker to come and evaluate the situation. And the nursing was also trained in how to continue the remainder of the evaluation. But this formal screening tool was used for all patients, and it increased the reported abuse on this in this emergency department from 1.34% to 3.17%, which indicates that this was very effective at increasing the number of reports of child abuse. Something that was not measured for this was how many more times, the amount of extra resources that was used for using the screening tool, as in hours of performing the screening, but which is a possible area of concern because we don't want to waste resources, but I feel that the benefit of reporting higher numbers of abuse outweighs the amount of time it takes to screen each child, and it allows interprofessionals to work together. So social work and nursing are working together to combat this issue of child abuse, and we are not the only mandated reporters. There are other reporters as well, but no child should have to endure physical abuse or any type of abuse. But any way that we can improve the number of reported abuse, I think, is a worthwhile effort to keep our children safe. And so I'm going to briefly describe the theory that I included for this concept. So the theory that I felt applied best to this was the theory of planned behavior, which I have right here. And I also have this in a digital form that I will submit. But the theory is there are 3 things that'll influence intention and behavior. Those 3 things include attitude towards the behavior, subjective norms, and perceived control of the behavior. And these will all lead into intention, and intention will lead into the outcome or behavior. So I feel that I changed the layout of mine a little bit more. So the label of my theory is Theory of Planned Behavior in a Pediatric Unit. And my intervention is the implementation of a screening tool for all admitted children. So we screen any child that enters the floor. We will do 2 questions, and if their score is 1 or more, then this will flag further prompting of questions and may prompt social work to enter the scene and address if there's true concern for physical abuse and how we should move forward with this. And so this intervention is going to affect the perception on how mandated reporters, or in this case specifically for nurses, as there are many mandated reporters, but specifically for nurses on this unit, and how so their perceived control on how they're able to report. It'll also affect the attitude of the nursing staff regarding physical abuse. And also, it'll affect the culture of reporting abuse within a unit or organization. And all of this will lead into adhering to protocol for reporting, and the overall outcome will be increased number of reported cases of child abuse. So for this, I feel that the perception of how the mandated reporters feel may change by this screening tool. So I feel that this theory really plays into this because there's a lot of things you can't control for when you're a mandated reporter. And there's a lot of heavy emotions about actually being the one to report. And due to there's a lot of repercussions for physical abuse and what may happen with custody and the child down the line. And I feel there's a very heavy burden or fear of reporting when there isn't actual abuse. I hear you, Addie. Mommy's doing it, but Mommy hears you. I'll help you in one moment. Dad. Yep, Mommy's doing something special for school. Dad. It's Mommy. Okay, I'm so sorry for the interruption. The perceived control of the mandated reporter and the perceived amount of power that they have, it can be a very heavy burden to be the one to report. But I feel that this screening tool will allow it's Mommy. That's Mommy. Why is that Mommy not talking? It's a photo of Mommy. She's recording a video. So adhering to the protocol of this procedure. Chloe! Okay. So sorry for the interruption. The perceived control of the mandated reporter and their ability to report, and if they're able to make a difference. I feel that by using the implementing the screening tool, it will take away a little bit of that burden because you must adhere to the protocol. We flag all children with these 2 questions, and then it moves to social work, where we work together. And social work may discuss with us their thoughts, but it shares the burden of this report. Also, the attitude of nursing staff. This could be good or it could be bad. It may affect the unit in a way that the nursing staff is frustrated that they must report this or that they have to follow these questions. So there could be frustration or backlash from a new protocol that some may feel is a waste. It could go the other way where the nursing staff really likes that there is now a protocol because maybe there's been times they've thought there could be abuse, but they weren't sure what they were supposed to do, and they didn't know, and they didn't want to be the first one to report, and they were scared of how it might affect the child and the child's relationship with their parent. So there are many ways it could affect attitude. And as far as culture of reporting, this I feel that once more reports occur, more people are willing to report. And I also have experience as a mandated reporter in a daycare, and I know the culture that we have in reporting abuse is we report to our supervisor, and our supervisor reports to the state, and they will collect data after generally several weeks before they'll reach out to the state. And I feel that this underserves some of the children, and there are cases where we don't report what I feel should be reported, although I'm not the overseeing teacher. So I feel that this will address increased reporting and the culture of reporting. I feel like it may make it so the organization is more willing to report. because signs of abuse should be reported. That's what we are as mandated reporters. We should be reporting it as soon as we feel there's any threat to the child, and it's up to the state to then determine. And it's out of our hands, but we collect the information that we can gather, and it moves on to the next level. So, I feel that we covered the appropriateness for the theory and how it integrates into my field. And we also discussed how it will the implication that it'll have on nursing. So I'll just close with I feel I'm sure it's come through in this video. This is a very heavy topic discussing child abuse, and there's a heavy burden on nurses for many cares, that especially in a pediatric unit for what we provide for children. But I think it's of the utmost importance that signs of abuse are reported and that no child should have to live with abuse of any kind. And if this screening tool were to be implemented, and even if it's just one additional case per year, that's one less child that was abused. And I think that that is the most worthwhile intervention for 2 questions. So I will be uploading these papers, and thank you for your time.